Good afternoon. It is Thursday, May the 13th, 2021. Sago, David Lahashu, Juts. Welcome to today's edition of the COVID-19 Task Force Update on this, our 210th edition of Kahnawà 911. On today's show, we'll be hearing from Alana Kane of the KSCS, and we'll also be hearing from Lisa Westaway, the Executive Director of the KMHC. And to start off today's program, we will speak with Alana. Alana?
Kahnawà, David. So yes, as David mentioned, my name is Alana, and I work at KSCS in mental health and addictions. So today why I'm here is mostly to highlight the fact that May is Mental Health Awareness Month. And so we thought it would be very important to give you a few updates on what's going on at KSCS and in other organizations with regard to mental health. So, like I said, May is Mental Health Awareness Month, and we know that the pandemic, of course, has had huge impacts on physical health, but it has also had significant impacts on mental health. And so it's important that we continue to talk about it and name it and make sure folks have the resources that they need. In fact, mental health actually, or mental illness rather, affects everyone. Recent data suggests, national data, that 1 in every 5 adults are currently struggling with mental illness, and that 1 in 6 kids ages 6 to 17 are also struggling with a mental illness at this time. Some more common mental illnesses are anxiety, attention deficit disorder, bipolar, borderline personality, depression, eating disorders, obsessive compulsive disorder, post-traumatic stress, which is a huge one right now, as well as schizophrenia. So what can be really difficult about mental health and mental illness is that it's often invisible, in the sense that it doesn't have outward signs like, you know, someone who might be having a physical illness. So there's no broken leg or bruises or that kind of stuff. And so I've noticed from the people that I work with and the people around me that there's really this sense of exhaustion, big time. But other signs or other symptoms to look out for, either in yourself or in the people around you when we're talking about mental illness, are excessive sadness or feeling low. Sudden changes in mood or mood swings, if you're noticing that in yourself or in others. Excessive feelings of anger or irritability when you just can't quite, get a grip. Difficulty focusing or staying on task. That's one that people tend to notice if they're at work or at school. Avoiding interactions, even with family and friends, even if it's people that you want to interact with, but somehow you just can't quite get around to it. Change in sleeping or eating habits, as well as substance abuse, perhaps more than usual, or thoughts of suicide, which are, more and more common. So I guess the message around all that, if you are noticing that in yourself or in others around you, it's okay. It's okay not to be okay right now, and to reach out for help. You could reach out to a friend or a family member. A really great resource that I think we don't use a lot because we're kind of not huge on hotlines, but one that really is fantastic is the First Nations Hope for Wellness hotline that you can call at 1-855-242-3310. And all of these numbers, of course, can be found either online or on the KSCS Kahnawà Facebook page. And of course, speaking of KSCS, it's also a great resource to reach out to us for help by calling 450-632-6880 and asking for our intake services. But, if you're someone who you're like, okay, well, I don't really have any of those types of feelings, but I'm still feeling just really blah, I'm still not myself. I don't really need to reach out, for counseling or anything like that, I would suggest, as a start, be careful how you're talking to yourself. Be kind to yourself, and make sure that your harshest critic is not the one in your head. Some other self-care tips for COVID. So again, if you're someone who's just kind of feeling blah and you're like, what could I do to kind of lift my mood a little bit and lift my spirits? Are make a gratitude list. As we know, of course, one of our key cultural practices is gratitude, giving thanks every day. So if you can, create a gratitude list of things that you're grateful for, that can be really helpful. Do some volunteer work. I know that when we're feeling really low sometimes, I know a while ago I went to work at the emergency food basket, and in the morning I was like, I have so much to do and I have so many emails to respond to. But I went there and it was actually really helpful to just do something different and to do something for others. It can be really, really helpful. Take some stretching breaks. We're sitting at our computer all day. We're sitting on our kitchen table sometimes. Get up, stretch, breathe. Create some structure to your day. Even if you're at home, even if you're online learning and you're like, well, I don't have the bell that's telling me what to do, or I don't have a lunch break per se, do it. Create some structure. Get dressed in the morning, have breakfast, have lunch, take structured breaks. Take it one day at a time, okay? Because again, what we're going through is rough, and just one day at a time. Read a good book, watch a funny movie, take a shower. I know that sounds really silly, but actually the fact of being in water is really helpful. So if you feel like you're just losing it today, you're super stressed out, take a bath, relax, go take a shower. Or video chat with a family or friend. I know we're all done with Zoom and Teams, we're all over it. But if you have someone who's kind of in another region or who might be far away, it can actually be really helpful. So lastly, I just have a few updates from the last time that I was here. I wanted to make sure that everyone knew that, again, sometimes it's us who's struggling, but sometimes it's a loved one who's struggling with either a mental illness or substance abuse. And so we have a virtual support group right now, or a virtual sharing circle for anyone who's affected by a loved one's substance dependence or mental illness. It happens every Tuesday evening, and I would suggest again to go to the KSCS Kahnawà Facebook page to get more information on that, on how to sign up for that. We also have free alcohol and substance use resource kits available, such as like pamphlets and booklets and that kind of stuff. So never hesitate to call KSCS, or again, go on our Facebook page to get more information about that and request a free kit. As well, I had mentioned the last time that we were creating a mental health action team, and that has happened, and it includes a number of local organizations, and we've met twice already, and we're already dividing into subgroups to really try and address the issues of key populations in the community who are struggling with their mental health in particular. So with that, I want to say a huge Kahnawà for having me here today and allowing me to share some of these things. And I just want to reach out to everyone and tell you that, remember, if you're not feeling okay, that your feelings are valid and that you are definitely not alone, and to never hesitate to reach out for us for help, because we're there for you. Kahnawà. Ona.
Thank you very much, Alana. That was extremely informative. Appreciate all the information. Coming up next is Lisa Westaway from the KMHC. Lisa?
Yes, thank you, Alana. It's really important to have these constant reminders that we need to be kind to ourselves and to each other during these difficult times. And thanks for reminding us of several strategies that we can use to take care of our well-being. So speaking of well-being, I'm just here to reiterate information that we gave yesterday. And And at the end of this, I'll give a bit more details as well about the testing site and where we're at with numbers today. So first, to talk a little bit about the reopening strategy and the phase 1 that we will implement as of May 21st, and some of the rationale behind that. So some elements that we look at closely are vaccination rates, both in the community and in our surrounding communities. So as you know, presently our 16+ population is vaccinated at 74%. In Quebec, in Montreal, we are at 44%, and in the Montérégie area, 18+ is 55% vaccinated, and 16+ is 44% vaccinated. And the vaccination campaign is going well in the regions around us, and we continue to vaccinate, not we, but the Quebec continues to vaccinate on a day-to-day basis, actually quite significantly, and they do expect vaccines to be available to all of their 18+ population just in a couple of short weeks by the end of May. We also know that our frontline workers are almost all vaccinated with their second dose, or will be by the end of the day tomorrow. So this is huge, although what we consider protected is 14 days after one dose. And so this is important because we've taken extra caution within the community to ensure that second doses happen, and therefore our second doses will be complete for our frontline workers before the end of May. Why is this important? Because we have to protect our workers so that when you do become sick or need services from the PKs or from medical transport or fire or KMHC, KSCS, that we're able to meet the demand. And if we're not protected and we have increase in COVID cases, there is a possibility that we won't be able to offer services to the community. So it was important that second doses happen for this population, and as I mentioned, it will be complete by the end of the day tomorrow, and therefore considered protected by the 21st of May. We also are in the process of planning second doses for the community, so this is something positive, and we'll be giving you more information shortly. We have preliminary data that is also demonstrating that the vaccine, Pfizer and Moderna vaccines, are effective against the most common variants found in Quebec right now. So although there are 4 variants found in Quebec right now, variants of concern as they're called, the UK variant is the most predominant. It's the variant that we've seen here in the community, and the vaccine, preliminary data is showing that the vaccine is effective against this variant. And we're now seeing a bit of an uptick in cases related to the variant from Brazil, but we're also seeing preliminary data showing that the vaccine is effective against that variant as well. And therefore, this is good news for us and gives us an indication that we can cautiously move forward. Lastly, and Alana spoke a lot about this, one of the areas that has significantly been impacted by the pandemic is all of our mental health, and that's why it's so important to be able to openly talk about this without any shame or guilt or feelings of negativity. This is common, and we could be comfortable talking to our family members and our friends very openly about how they're doing on a day-to-day basis. And one thing that impacted our mental health greatly was our lack of control over a situation, or that feeling of a lack of control, lack of ability to make our own decisions. And part of this reopening strategy, even though it's cautious, is to be able to give back some of that control to community members, the freedom to make their own decisions, to diminish the impacts of isolation in a way that's safe as much as possible. And so with this rationale in mind, that's why we had made the decision at this point in time to move forward to our phase 1 of the reopening strategy. It is a cautious strategy, and it's cautious because we do have COVID still in the community. And just a couple of weeks ago, we saw how quickly cases can escalate. However, we also saw communities' response to those increased cases, meaning following public health measures, respecting the isolation criteria that public health put in place, identifying, contact tracing, people really cooperative and being a part of the process. And this demonstrates our ability to contain cases as quickly as possible. So we do expect to have more COVID cases. This reopening strategy does not mean that we no longer have COVID and that there is no risk. There is still risk. However, we do feel that the cautious approach allows us to move forward in a safe way, as safe as possible. So what we expect from each of you and from each of us, from all of us during this reopening strategy, is informed decisions. So to remember all of the knowledge that you've gained over the past year about COVID, about your responsibilities, about the need to protect the community, and to think about all of those things when you do make a decision about an activity you might want to participate in, or whether you want to have somebody over at your house. So distance, hygiene, masking is super important. Knowing who's vaccinated and who isn't. Why is this important? Not so that we can judge, but so that we can protect. And the more we know and the more we talk, the more we speak with each other, the more we're able to protect each other in a safe and kind way. So this is really important, to have these conversations, know who's in your home, know what protective measures you need to have in place so that everybody is safe. Because trust me, I've spoken with people who inadvertently, without their knowledge, have transmitted COVID to someone else. And it's not a fun feeling, and nobody wants to be in that position. We may find ourselves in that position, and that's okay. But the more you know, the more you can eliminate the risk as much as possible. So it's just about knowledge and speaking to people and communicating that we ask, and that's the most important, so that this can be a successful reopening and we can hopefully move forward to the next phase gradually. So what are these measures that we're talking about that will be relaxed on May 21st? The first is outdoor gatherings. Indoor gatherings remain the same. 2 households in your home in a safe way, your households together, 2 separate households, more than 2 meters apart. Masks are really a good idea because we know that the biggest amount of transmission happens indoors, and so the more you protect yourselves when you're inside, the better, especially with variants. They are more transmissible, especially in enclosed environments where there's limited ventilation. So right now we're focusing on outdoor gatherings. We've increased from 8 to 12, again with appropriate distance, hygiene, masks, and that's if your space allows for that many people within, at 2 meters apart. So 12 people outdoor gatherings. Restaurants. Restaurants are also going to open at 25% capacity, both indoors and inside the restaurant and outside the restaurant. It is for Kahnawake only at this time, and it is only 1 household that can sit at a table together. So you can't go, unfortunately, at this time, 2 couples to the restaurant. It would be just whoever's living in your house at one particular table. This is really important. Again, I say the word cautious. It's a slow opening, and we had to evaluate the level of risk and find a balance. And considering the lower rates of vaccination in the surrounding communities, we didn't feel that it was an appropriate time to be introducing people who are not vaccinated into the restaurants. And it's okay if people within the community are not vaccinated, because our rates are high enough that one protects the other as much as possible. So I know it's complicated to understand, but those vaccination rates impact the decision we made regarding who can be in the restaurants at this time. This is a temporary measure until Quebec opens restaurants, in-dining restaurants in the communities around us, meaning Montérégie and Montreal. So for the time being, that we felt that this was a safe, cautious way of starting our reopening plan. So 1 household, only Kahnawake, at 25% capacity, if for in and outdoor, both terraces and inside dining. Recreation and outdoor sports. This also is maximum of 12 people on a field at one particular time, and there are COVID rules in place, safety rules, especially each organization's or each association has very, very strict rules. So for minor baseball, for example, Softball Quebec, soccer, there are very specific rules that exist that have passed through the task force for approval, and the expectation is that each team have a representative that ensures follow through of these rules during playtime. And there are other specific guidelines, no spectators, for example, so that there is no gathering and any chance of breaking the distance rule at this time. So again, this is a first step, a cautious step, but allows us to participate in outdoor activities as much as possible, where there's limited risk in transmission of COVID, considering that we're in outside as well ventilated. Lastly, we've increased the ability to have more people in churches or during ceremonial activities to a maximum of 50 people, but again, only at 25% capacity. We always are looking at that 25% capacity inside because of the increased risk when you're indoors. And I'm mentioning this to you because of the importance when I say being informed and being able to make your own decisions. When you go into an enclosed environment, even at 25% capacity, there is still risk of transmission of COVID-19. And therefore, when you go into a place indoors, a restaurant or a church or anywhere else, you are still making a decision that you're accepting the risk that you're placing yourself or your loved one in. So it's important that you have this information to be able to make those decisions. So for restaurants and for churches or places of worship or longhouses, for example, reopening all the restaurants all require inspections, and this is exactly the framework that we had in place back last year in June when we reopened businesses as well. And it's a luxury that we have here in the community that didn't really exist anywhere else, and it's an element that added much to our success. So we are reinstating that this time, although the inspectors have been active all throughout the whole year, doing spot checks and visits to businesses to ensure that they're following the rules. They're going to be ramping up their visits, and again, restaurants will require a certificate and a visit from an inspector approval basically before they're allowed to open. So on the screen you're going to see how to contact an inspector, and this is where you need to contact when you feel that you're ready and that you're meeting all the standards. You can access the business standards on the COVID-19 KMHC website, the reopening section. All of the business documents are there. And for more information, the inspectors can answer all of your questions. So please don't hesitate to contact them at that contact information that's on the screen. So lastly, I want to talk about cases in the community. So the testing site continues to be open and to be busy. We do our screens of employees of KMHC, KSCS, KFB, and PK for those who aren't vaccinated. Those screenings continue to take place, and we are also testing people with symptoms. So just a reminder, for this reopening plan to work, when you are sick, you shouldn't be out, you should be home. Part of your informed decision making is to do your daily symptom health check. It's a personalized thing, you're doing it on your own, but if you have any symptoms of COVID or you feel that you may have been exposed in any way, it is all of our responsibility to go and get tested. The testing site will not refuse anybody, or at least they shouldn't. So if you call and feel that you may have been exposed, or you have any symptoms whatsoever on the COVID checklist, and that's also on our website, then please contact the testing site to be tested. If we do this, we will be able to contain COVID within the community even when we have cases, because we'll be able to identify cases very quickly, contact trace, and keep everyone safe. So it is our responsibility to stay home when we're sick, tell people around us that we're not well so that they stay away and go and get tested. Right now we have 5 active cases in the community. I'll just show you the chart. So we've had one new case over the last week or so. I can't see the date there, May 8th, I think, May 5th. Anyways, we had one new case actually just today. So we have 5 active cases. The other 4 are left from the previous outbreaks or clusters that we had. And so as you see in the 3rd wave, we've had a total of 25 active cases. 2nd wave was still the longest and the biggest and most difficult wave, although in this 3rd wave it was the most cases I think that we had related to an outbreak. But we're doing well, and as I said, we were able to contain those outbreaks quite quickly, and people were very collaborative, and that's what's most important in this process. So, so we just urge you to continue doing what you're doing so that we can continue to do our jobs as well and guide you through this process. So again, if you have questions, please contact the inspectors, and I guess that's it for today. Thanks.
Thank you very much, Lisa. A lot of information there, and we appreciate your time to explain everything to the community. And that's it for our show for today. So from all of us here, thank you very much for joining us. Until next time, Yawagoa, Danu, Wanagiwahi.